everyone! Welcome back to Medicare USA. If you're new here, don't forget to like, share, subscribe, and hit that bell icon for instant and regular updates. Today, we're diving into the world of arteriovenous fistulas or AV fistulas. What are they? Why do they matter? Let's find out. An AV fistula is an abnormal connection between an artery and a vein. Normally, blood flows through tiny vessels called capillaries, where oxygen and nutrients are exchanged. But with an AV fistula, blood bypasses these capillaries and goes straight from the artery into the vein. This can mess up normal blood circulation and cause all sorts of trouble depending on where the fistula is and how big it is. There are two main types of AV fistulas. Congenital, which means they're present at birth due to abnormal blood vessel development, and acquired, which happen later in life. Acquired fistulas can be caused by trauma or injury like stab wounds or fractures, surgical creation for dialysis, access in kidney failure patients, or certain medical conditions like infections or vascular malformations. Now, where can you find these AV fistulas? Dialysis AV fistulas are usually created in the arm for easier access to blood during hemodialysis. Pathological AV fistulas can pop up anywhere: brain, lungs, gastrointestinal tract, or even your limbs. Symptoms? Small fistulas often don't show any symptoms and are found by accident. But large fistulas? You might see swelling or bulging, feel a pulsing sensation, experience pain, or even have heart-related symptoms like fatigue or shortness of breath. Diagnosing an AV fistula involves physical exams to detect sounds or vibrations, and imaging studies like ultrasounds, Connecticut, MRI angiography, or conventional angiography. Treatments vary. Small asymptomatic fistulas might just need monitoring, but larger ones? They might require surgical repair, endovascular procedures with stents or embolization, or compression techniques for superficial fistulas. Complications can include heart failure, blood clots, bleeding, or tissue ischemia. And there you have it. Everything you need to know about arteriovenous fistulas. Want more details on a specific type or treatment? Let me know in the comments. Thanks for watching. Don't forget to like, share, and subscribe to Medicare USA for more medical insights. Bye for now.